Hi, I'm Dr. Rashmi Yogish, Clinical Director and Consultant, Khushi Fertility and IVF Center, JP Nagar, Bangalore. Is infertility only a woman's problem? Definitely no. Men and women are equally responsible when there is no pregnancy. In fact, infertility is always a couple's problem and not just confined to only the man or the woman. Of course, the organs that are involved in reproduction are more in number in the woman as compared to the man, and that's the reason why the complexities can also be more in the woman as compared to what it is in the man. We've seen that a lot of women either have hormonal issues because of conditions like polycystic ovaries, or on the other side of the spectrum they can have very low oocyte numbers, which is called as a low ovarian reserve. We've seen that the diminished ovarian reserve could be either due to genetic conditions or it could be due to stress, whereas polycystic ovaries is mainly because of a genetic condition or due to lifestyle that can have a bad impact on the hormones and thereby flare up the clinical condition of polycystic ovaries. Similarly, in men, lifestyle conditions can reduce the spermatogenesis and make the sperm count, motility and morphology, or the number of sperms that look normal, deteriorate. We have seen that in men who sit and work for long hours, there can be swelling of the veins around the testis, which is called as varicocele, and this can reduce the sperm motility and also increase the abnormalities in the sperms. There can also be an increase in the damage to the sperms, and this can be measured by something what we call as the DNA fragmentation index, which is actually an index of damage to the sperms. Apart from all of these, like how women can have high levels of FSH, and that can indicate about the reducing ovarian reserve, even men can have high levels of FSH, and that would indicate something called as a reducing functioning of the testis. So this is what is called as the secondary testicular failure. It's not unusual to see semen analysis reports that are deteriorating. The deteriorating semen analysis could be due to varicocele, as I previously mentioned, or it could be due to a hormonal condition which is called as the secondary testicular failure. With age and with time, due to issues with lifestyle or because of increased exposure to toxic chemicals or even exposure to electromagnetic radiation and mobile phone radiation, there could be reducing functioning of the testis. And as the testis fails to do its function, the brain starts to produce more and more stimulating hormone to make sure the testis awakens and starts functioning properly. In such cases, the FSH hormone, the stimulating hormone from the brain increases. And therefore, an increasing level of FSH from the brain and reducing level of the sperm count can be an indication of a secondary testicular failure, or in common words, evolving testicular failure. An evolving testicular failure will also show up with reduced levels of testosterone, the male hormone that is mainly produced in the testis. Therefore, as we see deteriorating egg counts, we should also be cautious about deteriorating sperm counts and take it seriously. Measure the hormonal levels in men too, and not just women, and make sure the man is also not heading towards something what we called as andropause. And similarly, menopause and andropause can occur at a faster rate than what it is actually supposed to happen due to lifestyle factors and exposure to toxins. We are all exposed to toxins on a daily basis, but ensuring that we maintain a healthy lifestyle, at least till we fulfill our dream of parenthood, is direly essential. And so it's really an important fact to be addressed to, and an important fact to remember and understand, that male and female fertility issues are equally prominent, and infertility is always a couple problem and not just a problem confined to the man or the woman. Apart from all of these, we sometimes see that the man is also perfectly normal with respect to his sperm counts, and the lady also doesn't have anything that can make her pregnancy, getting pregnant, difficult. But still, we see that there could be issues with respect to achieving a pregnancy naturally. This could be due to a genetic combination of the eggs and sperms not matching well to produce embryos. This is because sometimes there could be a combination of egg and sperm that produces more number of normal embryos, and therefore getting pregnant is not at all difficult. On the other hand, there could be a combination of egg and sperm that produces less number of normal embryos, and therefore they take longer time to achieve pregnancy. And therefore, it's important to understand that a particular couple put together can differ in their time to conceive, or the TTC. The time to conceive varies with respect to the combination of the husband and wife, and it's always a combination that works and not just the egg or just the sperm. And therefore, fertility is always a couple victory, and infertility is always a couple problem, and it has to be addressed equally in both the man and the woman.